Hi guys, it's Angela, and it has been 5 days since my gastric bypass. It took me a while to go ahead and get on and do another video, but I do want to give you all kind of a rundown of what happened at surgery and then what I've been doing since. So I went in for surgery on Thursday, December 8th. And my surgery was moved up from 1 o'clock to about 10:30, so I had to be there about 8:30. And of course, then I didn't eat, of course, from the night before. When I went in, they do all the prep and give you an IV and everything. They had a hard time with IVs for me. They had to stick me 3 times. And as a nursing student, I kind of want to put this out there. Nurses are not incompetent. There's a lot of different things that they have to deal with when they're trying to put IVs in and dealing with all the surgery prep. It's not because they can't do it or they don't have enough skills to be able to do it if they don't get your vein on the first try. There are a lot of circumstances that can affect their ability to do so. And dehydration can be a very serious one. For me, I was very dehydrated already before surgery. And my veins in my hands were spasming, so it caused some problems with them being able to get an IV right away. So I want to give them props because they were awesome, that it's not their fault. I was dehydrated. So I did go into surgery about between 10:30 and 11, and got out of surgery somewhere between 12:30 and 1. I remember waking up in the recovery room actually I'd been hyperventilating. I don't deal with anesthesia very well, never have. I've been through surgery before, so I knew that this would happen with me. But I remember coming out of it and thinking, oh, I can't go through this. I can't go through this surgery because I knew I was going to have this reaction afterwards. But then I realized that I'd already had the surgery and that I was dealing with it at the time. It's kind of bizarre what your mind thinks when you're waking up from surgery. But after about 15-20 minutes, I was fine. I was breathing okay. The nurses actually were great. They said that I was fabulous in dealing with all of that. I got a very, very nice compliment in that the nurse called up for my room and said, hey, we're bringing up Angela, giving them all my stats and saying, hey, she's 41 years old. She looks 21. And I was like, I like you. So that was kind of fun. And she told me as I was going up to my room that I actually woke up after, in surgery. They had finished the surgery. They were stitching me up and they were starting to bring you out of surgery, which they bring you out of the anesthesia. I came out really, really fast, and I guess I came out swinging. And they just didn't anticipate that. It can happen. I don't remember it at all. I don't have any recollection of this, but evidently I was like, freaking out. And then they put me right back under, and that's when I remember coming out. So I don't remember any of that. It's not that they did anything wrong. I know how I react with anesthesia. I don't react well. So Thursday night, I did ice chips. They got me up and walking around. My blood pressure, which I had borderline high blood pressure going into surgery, and I've had it for years now. About 142, about over 92 has been kind of my norm for quite a while. It was completely resolved. My norm now is like 110 over 62. I think yesterday it was 116 over 72. So very much in the normal range. So I haven't had to take any blood pressure medication. I was just on a really basic diuretic, so nothing major. But I didn't have to start. Didn't have to take that again after surgery. I did have to take some anti-nausea medication and a little bit of pain medication, but I was not in a lot of pain. And Friday, I was up and walking around quite a bit, and I had a little bit of nausea on Friday morning, but then they gave me something for that. I didn't have any problems. Fridays when they started me on clear liquids, and I wasn't hungry, but I was very much thirsty, and by the end of Friday they realized that I was way dehydrated. I was severely dehydrated, and so they actually had to hook me up with some fluids, 2 bags of fluids, and by Saturday morning I was fine. And I was released at, let's see, by noon on Saturday, and my doctor just said that I had to drink like a quarter of a cup of Carnation Instant Breakfast and keep it down for me to be released. And I got that down, and that's all I could get down. I was full after that quarter a cup, and then they let me go. So I came home, and Friday was really good. I got all my fluids in on Friday, and I think that's the biggest thing is after surgery, the 2 things that they want you to do is get all your fluids in. That's the most important thing, because you do risk dehydration, especially within the first couple of weeks. And with me already having been dehydrated, it was extremely important. And then also getting all your protein in. Well, I need to get 64 ounces of water or fluids, which includes milk, includes clear liquids, includes anything that's decaffeinated. The goal is 60 grams of protein, but they realize that that's a challenge, especially within the first 2 weeks. I'm in the 5th day out, and yesterday I got all of my, excuse me, I have to cancel something here. Sorry, my computer's, there we go. What was I saying? Okay, I've gotten all my fluids in every single day. Yesterday I got all my protein in, just over 61 grams of protein, in fact. It was a very big challenge because I am not hungry at all, and I am drinking or eating pureed food, very pureed food, the consistency of applesauce, pretty much all day in order to be able to get everything in. And it's not like I'm grazing, it just takes me a long time to eat. This is a quarter of a cup, and they gave me like 5 or 6 of these after my surgery to take home, and that is pretty much all I can have in a meal. I had this of low-fat, sugar-free yogurt this morning, and then I also had for a snack some pureed chicken salad, and it took me almost an hour, 45 minutes, to eat both of those containers, not both, one of them over that period of time. So the hard part is that I don't feel hungry, and but I don't know, it's a kind of a weird feeling trying to get used to your pouch. You realize that something's different. I see how people can not recognize the feeling though and just want to eat whatever. So the trick is to really eat slowly. I have been eating extremely slow and drinking extremely slow, sipping very, very slow, and using a baby spoon, which everybody said that, sounds so ridiculous, but it actually helps. It really, really does. And so that's worked for me. I'm feeling really good. This is the 5th day after surgery, and I'm in very little pain. I really don't have any pain, but over the course of a day I can start to feel a little cramping in my back, and it's really, the doctor said that that's really the healing that's taking place inside, and it's kind of a radiating pain. I got some Lortab, which is a liquid painkiller, basically about the strength of 2 Tylenol for the dose that they want me to have, and I take just 1 dose in a day in 24 hours, and I can have, I guess, like 10 doses, but I only need 1, and usually it's right before bed or right before I get up, or right as I get up. So usually night is when I feel it. During the day I'm okay. So I'm doing really good, feeling awesome considering that I had surgery just 5 days ago. And I've lost 8 pounds, at least that was the case as of yesterday. I'm not weighing myself every day. I'm not going to do that. I don't want to be the slave to the scale. And that's 8 pounds after because they pushed so many fluids into me, I actually came home weighing about 5 to 8 pounds more than when I went to the hospital. But that's because I had so much water weight, so many fluids still in me, and gas. You do have some gassy feeling inside after, and that lasts a couple of days, but actually it's not been bad at all. So I'm just here to say it was a good experience for me. The challenge is obviously after and learning how to eat, and I'll probably talk more about that in my next video. And I'm just looking forward to getting through the healing process. And my next appointment is in about a week. Actually, it's a week from today. And then the doctor should be able to release me to do more activity. I actually did do a 1 mile Leslie Sansone walk today, just 1 mile this morning. I plan to do 1 more mile this afternoon, but it's called her slow and easy walk. So it's 1 mile over like 18 to 19 minutes. So it is pretty slow, but I don't want to push it since I just came out of surgery. So it's just to get my blood moving, get to, the air in the lungs and so forth. So that's the update for right now, and I will update you guys later, probably a week from now. Okay, bye.